By James Kelly.
Thank you, Presiding Officer. I'd like to put in record my thanks to the Cabinet Secretary for Health for all the actions of the public authorities in dealing with the cluster in Port Glasgow. But can the Cabinet Secretary make me aware of any lessons that have been learned in dealing with this cluster, which can then be utilised to help across the country any other clusters that will take place?
Cabinet Secretary.
So I'm very pleased to say that in terms of the Port Glasgow cluster that members will recall involved a local pharmacy and another local business, there have been no further cases with respect to that cluster since Saturday, and at this point the incident management team has agreed that it can stand down. In other words, it believes and has the data before it to tell it this, that it has reached the end of the transmission chain, so they have successfully contained that particular outbreak of COVID-19. There are always lessons to be learned. We learned lessons from our very first outbreak and use of test and protect in Dumfries and Galloway. But the important part for us is that the local incident management team can make decisions backed by the national support that we give in the system of test and protect that makes sense for the particular incidents that they are looking at. And as I'm sure Mr McMillan knows, the outbreak in Port Glasgow is significantly different, for example, in a number of important respects than the one that we are currently dealing with in Aberdeen City. So those lessons are learned. The IMTs talk with each other and provide us as Scottish Government with any additional support that they believe we should be offering them, and we are taking all of that very seriously.